Hello, my Red Tribes, and welcome to another episode of Dr. Red Diaries. Okay, so today is a special day, actually. So today I'm going to be having my first guest, and she is my friend, but she has a very special story to share with us today. This story, personally, to me, is dear, and um, it's a story that I also want to share with the world for us to hear, to get inspired, encouraged, and to just learn one or two things about Nigerian healthcare system. Without too much story, let's welcome Omotola.
I read Tribe. I'm happy to be here and thank you, Dr. Red, for having me.
Thank you for coming this morning. Like it's I'm so happy that you're here actually. I am actually happy because it's one story that I have really wanted to share, and the fact that you obliged me and said, "Oh, I'll come to Dr. Red Diaries and share the story," and I'm excited and I'm so grateful that you are here. So today we'll be talking about your brother actually. So I'm going to let you talk, but we'll be talking about your brother and his story, how he fought, and every beautiful thing about him. You get, so that's what we'll be talking about. So maybe I should just let you do like a brief mini introduction of yourself.
Hi, Red Tribe. Once again, I'm so glad to be here. So my name is Omotola, and I'm a senior brother to a wonderful brother. I'm a senior sister to a wonderful brother. How do I introduce myself? I'm a chef and I'm also a banker, and I'm glad to be here.
Yes, he's actually a very good chef. But anyways, let's not digress from the topic. So today we're talking about your brother Daniel, and can you just just give us a little bit about your brother, how he was, his personality, what made him special to you?
I'd say a lot of things made him very special. He was a very sweet child.
Yeah.
That one thing I will never forget about him. He was
Yeah.
a very, very sweet child. He had his own challenge, but through those challenges, you would see that he was really strong.
Mm-hmm.
He would never stop laughing.
Yeah.
He loved food a lot. He loved money. Like he loved, and he, you know, I think I don't know how to put it. He did not put that consciousness that he had a challenge in his health. He would walk up, try to talk, try to play with people. He's very excited to step out on, like, people trying to like cover when they have a little challenge in their body,
Like a medical condition, yes, disability.
Yes, they try
Yes. They feel shy, yes, they're embarrassed, yes, because of the stigma and so on. Let's just talk about what the medical condition that your brother actually had.
Yes, so he had cerebral palsy.
Yes.
He had cerebral palsy, and it was very, very tough to manage because when we discovered that was a condition, I was still very little. I just knew that, he experienced seizures at some point.
Yes.
And he was tongue tied. He could not talk
Yes.
very well. So he had a lot. Those were like a very big struggle for him.
Yeah.
And he could not control his saliva,
Mm-hmm.
which, though with training and every other thing, he tried to put himself in check, but that condition really restricted him from doing a whole lot of things.
Yeah. So if for most of people that I don't know about cerebral palsy, it's actually a congenital disease. It means that it's a medical condition from birth.
Yes.
So it means that it was actually born that way, and it's a condition that affects the brain. And most times, for people that have cerebral palsy, they have physiological abnormalities.
Yes.
Like they're not able to function like their age group. They have this if I can use this word, like mental retardation. Let me use that word.
Yes,
You get, they're not able to speak properly. They're not able to articulate their words. Like they would say when they are like maybe 10-year-old, some of them might have the brain, so to say, of a maybe 3-year-old or 4-year-old. So they were, and like you said, there are people that they also have seizures. That's one of their most common symptoms, so to say, or complications.
Yes.
They always have seizures, and I understand because I've had the privilege of treating or managing children or even teenagers that had cerebral palsy, and it's a very mentally draining for me as a medical doctor, but it's more mentally draining for the guardians or the caretakers or even the parents of that particular child. But let's talk about something. Let's talk about your challenge with Nigerian healthcare system. I know you are going to the hospital almost all the time, and I know at some point you spent a good number of times in the hospital, but I just want to talk about like the challenges that, what was it like navigating the healthcare system, especially in Nigeria, with him as a special needs child?
It was very difficult. One thing I would never wish for my enemy is to be at the hospital. In the government hospital, you will cry blood.
Yes, actually, I agree with you.
It was so frustrating. There were times we had to make some of the nurses there like friends, so that you have to tip your way in.
You have to make friends with nurses.
You have to make friends with nurses,
yes.
So you get like a preferential treatment.
Yes.
So it was very difficult, and there is the way they schedule their appointment is so crazy that you would be like, hey, God have to sustain you to your next appointment.
Yes.
It's very, very crazy. You can see that this thing requires urgent attention, and they are getting called back in the next 3 months.
You can imagine.
And you'll be like, God, you will not die before that time.
It's one of the common terms they use in Nigeria. Say that let Nigeria not happen to you, but truly, I always say let Nigerian healthcare system not happen to you, because especially when you have emergencies or you have like your brother that had this long-term medical condition where, or even I need special care, special attention, and sometimes it might go from 0 to 100, like in terms of his condition, any complication. So I can imagine the challenges that you have to go through. But do you have like any experience, as in special story that you can share? Share with us. Share with us. That's the idea.
I'm just going to talk about the major one that I think will always stick to me was the one that led to his passing.
Okay.
It really struck us because few days, I think it was 3 days after my birthday, and he started having the seizures. So at first we felt like, it's the normal way he has seizures. We have the way to, manage it in the house before taking him to the hospital.
Yes.
Have to keep him warm, keep him low, all of those things.
Mm-hmm.
So until I said, okay, it's now like the second day, and he's not even supposed to, after 1 day, 2 days, 3 days, he's already fine. At least a week is recovering.
He will recover, yes.
So after like 3 days, I saw that he was still down. So let's take him to the hospital. Like, I was very restless. Let's just take him to the hospital.
Yeah.
So the hospital that we use is very far at Yaba, and we're like, okay, at this point we have to take him to Bagada Hospital. Yeah. And we got to Bagada Hospital, and they were like, who is the mother? I'm like, okay.
You can imagine. You can imagine the first stereotype mother. Like, you're seeing a group of people, you're asking who is the mother. There are people here.
Yeah, already. I was like, okay, his mom is late and I'm his guidance. So
yes.
This I can give you
his medical history. Yes.
So like, okay, just hold on. And they kept us waiting for like 45 minutes.
Wow.
At this point, we had to like get water, glucose, and everything to just keep him, because the whole thing happened so fast. And we waited 45 minutes outside before going in, and they just came with, okay, just hold on. Let's get another doctor. You waited for her to come, and when she got when the other doctor, so I was just like, okay, she's going to be passionate. She's a mom. She looks elderly.
She would understand.
It was not it, my dear people.
You can imagine.
She came and said, okay, you know what? Why don't you guys just try to go to his hospital?
You see the problem. You see the thing I just said. Sorry, let me just cut. You see that thing just said. I think in one of our episodes, I spoke about my personal as a medical doctor dealing with emergency department in Nigeria, where they will keep the patient outside to assess the situation and try to refer the person out because they don't want to manage the case, which is a terrible thing. You've not even given any first aid. You've not even given any treatment. Did any doctor come at any point to even see him?
So it was just they did not even come close. And
You can
they were
imagine.
they were just peeping from where they stood to the car.
So you can imagine medical professionals
Doing like that.
stigmatizing
Yes.
someone because he has cerebral palsy and was having seizures. You can imagine, is it contagious? Like you can imagine, I can imagine how you will be feeling if a medical professional, a nurse for example, is treating your brother like that. How will normal regular people treat him?
It was crazy because we stood there and she was like, okay, you know what? I was like, we can't even get to the hospital right now.
Yeah.
We can't get there right now because it's kind of far and we are not even, it's evening, we are not sure the doctors will be there.
Yes.
They are working hours there.
Yes.
And she was like, okay, you know what, just hold on. She took some time again. And when she came outside, she said they don't have bed space.
Ha!
I was like, okay, I would go back to the house.
Unbelievable.
I would go back to the house and bring his bed. What we just say, just whatever you can pass into his
That's how
system.
desperate you were. You can imagine.
I was just like, I would go back to the house to get his bed to come back, and they were just like, even with that, so we just need you to. So that day, we had to take him back to the house. With
Oh
his
my
condition.
God.
We took him back to the house. That was the longest night I've ever had because I was just waiting till morning so we can now move to his own hospital.
His own hospital, yes.
So that time we were just managing, trying to give him enough fluid, water, tea, just something to like sustain him. That was what we were doing throughout the night till morning. And thankfully I have a cousin, she was studying at that time she was studying medicine. So I think one of the hospitals that she did internship, she said okay, she can just pull a call through. So she called them and they were like, oh, you can bring him. I was like, thank God. So I think those people, they gave me like a
lifeline, like hope that things are gonna get better. Yes.
So I feel that if I did not go there, I would just write off Nigeria hospital. I would write them off.
I agree.
Entirely.
Yes.
But that was one outstanding experience I had. Right from they kept calling, we're on the way. They were like, okay, can we send our ambulance? I was like, wow, don't worry, we already got a ride. We're on our way there. Right where we stepped into the hospital, they were on standby. Their beds were ready. It looked like, am I in a movie?
Am I still in Nigeria or another country?
Compared to where
the experience you had before.
So they were right on there, rushed him in, tried to perform CPR and all of those things. So they managed us because before they announced that he passed on. They really managed it. I think this is a thank you to them because they really managed it very well. The emotional intelligence was there. They didn't just break the news compared to last week where I had my mom.
Yes.
And I think that one is another worst experience on its own. Where we took my mom there. She was already in a state of coma.
Yes.
So we had to transport her from the private hospital down to Lasso. And we got there. This is someone on coma and you are bringing a wheelchair. I'm not even a doctor. I'm not in that line, but I know that is not the right.
That's not the right thing to give someone a coma. It's a stretcher for Christ's sake. Yes.
They got a wheelchair and we're like they can't. There's no bed. They can only afford to put on a wheelchair. And I was like, what is going on? And with my mom's sister was there. So she was like, she's going to sue. She was at magistrate. She got out a ID card.
Yes.
I will sue you people. So when she did all of those things, that was when they said, okay, you can go to the pharmacy to get these so drugs. I'm like, what drugs? This person cannot even open her eyes.
She's unconscious, for Christ's sake.
So how would she take down the drugs? I was like, I'm not even a doctor and I know these things. Like, how would she even take down the drugs? She had not eaten anything. She's been on fluid and like the way they've tried to manage her at the private hospital where we're coming from. So why would they even recommend the wheelchair and the drug in the first place? So it was a very bad experience. And just like after like 1 hour that we got there, they announced that she had passed. So I feel like all of these things I would have lost these two people.
Yes.
If not for medical negligence.
Yes, I agree with you.
They will still be here.
Yes.
Which is very sad.
Yes, it's actually very sad. Thank you for sharing the story. It's actually very sad because if there's one thing that I personally have dealt with is I spoke about this before. I always have struggled declaring a patient dead. So because most times I try to put myself in the shoes of the family members, even though they always tell us doctors don't put in emotion, but it's very difficult because I'm a human being. It's not water that is flowing through my vein, it's blood. For Christ's sake, I have emotions, I have feelings. But you can imagine the treatment that you actually got for your brother, for example, from the first hospital, that was the government hospital, and then now imagine the treatments you got. Was it a private hospital they took you to, or another government hospital?
I'm not sure. I don't think it's a private. It's a Lagos State Emergency.
Okay. So you can imagine the experience was very different. So that's why I always I try to talk about these things, is because of the fact that I always say, being a medical practitioner, be it a nurse, a health worker, a community health extension worker, a medical doctor, a consultant, it doesn't take out the fact that you are a human being. You have feelings, you have emotions to express, and you can't stigmatize or push people away. But the best things I feel like they can do, or they could have done then, if they are at that particular time, because every minute counts for people with cerebral palsy, and then they have active seizures. So every minute counts, every hour counts, every second counts. So if they had done something like you said, if they had really applied some form of first aid, some form of resuscitation, done something, they cannot tell me they don't have doctors. Imagine a government hospital without one doctor to come and see an emergency case. Like it's terrible, it's crazy, and it's that's the idea of this podcast, is to really talk about these stories and to really create awareness that, in as much as this is what is going on in the Nigerian healthcare system, but there are still good aspects, so to say, and things that we can actually do to really help the Nigerian healthcare system. But I have another question for you. So my question is, did you ever feel like isolated especially with your brother's case, or misunderstood, or that your sibling was not treated with the dignity that it deserved? Because I know, like, it's like I said, I've had the opportunity to treat people with cerebral palsy, and it's a very sensitive situation and condition. So do you ever felt that way, aside from with healthcare workers, but in general with people?
I did. But I think how did it happen? I think we grew out of it.
Okay.
And we understood that this is it, and we're just here waiting for a miracle to happen, waiting for his healing.
Yeah.
So what we can do, we have to love him. And if I don't love him, other people outside would not love him. So there was a stigma that went with him, with neighbors and other people. Like, they took advantage of his situation.
Yes.
To lie against him.
You can imagine.
He can't express himself.
He can't explain. Yes.
So he can't
stand up for himself.
In the compound, and they'll be like, "Oh, it's Daniel."
Wow.
And he would struggle to express. He said,
Yes, I understand.
So we knew the things he could do. We knew the things he could not do. So what we just have to do is defend him. And when we get inside, did you actually do it? Did you actually do it? Did you try to tease him? Try to get him to maybe to say something. And then you say, no, he saw somebody. There was, because we had spent so much time with him, we had an understanding when he used
on how he communicates. Yes.
And it was very beautiful that he knew how to call some of our names, some simple names. It was not very clear.
Yes.
But he knew how to call like short names. Like, you would know that, oh yes, this is the sound he's trying to talk to this person. So we used those ways to like communicate and try to talk to, what happened, and you express yourself, this person slapped me, hit him. So it was tough, to be honest.
Yeah.
It was a very tough journey, because even when we go out, we get to see maybe parents say, don't go near him. It's good, like,
as if he's contagious.
Yeah, exactly.
Like
it's contagious.
It's a terrible. That's one challenge we have in Nigeria healthcare system: stigma. Like, if there's one thing I know, I'm going to talk about stigma on another episode. Like, how we really stigmatize certain medical conditions. You don't even understand it. We just, especially people with seizures, for example. People have been stigmatized for having seizures, for being epileptic, or having maybe a seizure disorder, and it's terrible. But how old was Daniel before he passed on?
He was 16.
Was he going to school?
Yes, he was going to school, and to my surprise, when we announced his passing in school, and they came and the teachers came to the house. There was a special school he attended.
Yeah.
So when they came to the house and they said the things he could do in school, I was just like,
Wow.
wow, like even like, oh, there are other students or
Yes.
children that even had way worse, the experience worse than he
Than
did,
him.
because they said he was very smart. That even when they teach other students, they have to like teach them, and continue to teach them. Like it's not like they get promoted from the class; they're just there to
Continuous learning, actually.
till
Yeah.
they are able to get like a skill, a vocational skill.
Yes.
So when I say it was very different for him, because they taught him his alphabet, he knew his alphabet, he knew his numbers, he knew how to count money. My brother like
He's out to count money.
he did money, 1,000 naira, 5 naira, he did money. He really liked
Yeah.
money. So it was very like so it was then that we got to know that, oh, okay, so he could even do more than what we thought he could do.
Yes, actually.
But the stigma was very, very,
Yeah, so
very
that's the
bad.
beautiful part about as in sending people like that, like someone like Daniel, to a special needs school. Yes,
Yes.
because they get to see and meet people like him. Let me go with that.
Yes.
They get to also learn. It's not a case of because somebody has like a long term or a terminal medical condition. They have to be written off. No, they have that opportunity and
They
right
feel
to
belong to a
live.
community.
Yes,
They
there's a
feel,
community
yes,
for them,
yes.
and I feel like it's also one community that we need to really create awareness more, especially in Nigeria.
Nigeria.
Community for people with cerebral palsy, with special needs, even Down syndrome, and so on and so forth. So they don't feel left alone. They have somewhere they can fall back on. They can go back to when they will be going through life, because even we as humans with better functioning, let me use that word,
Yes.
we still go through life. Life is life in a lot of people. So you cannot imagine what they would be going through. That's why I saw him as a very strong person, because I see people that have some form of mental condition as well as strong,
Yeah.
not just mentally but emotionally and physically, to be able to go through life and not want to give up. Do you understand? Not want to give up, not want to say, oh, I don't talk like other people, I don't sound like other people, I don't do things like other people. So that strength alone is one of the things I actually admire about Daniel. So my next question for you, because we're almost done, is after his passing, how did you and your family cope, and what helped you to hold on during that time?
It was really a tough experience, because I think it affected my faith to an extent. Not to an extent.
I
to a very
understand.
large extent.
I understand.
It affected my faith. I isolated myself too, because a lot of people like myself who that didn't know his condition, I had to like explain it to them.
It's like reliving the whole experience.
Yes, I had to
Yes.
explain it to them that, oh, he passed on because of this. He's been like that since childbirth, and he struggled with that. So it's like every time I have to say the same thing. I did not even know that, like, there was a part of me that I'll just say things, and I'll just have to remind myself that, oh, sorry, he's not here. Like the first week, I was
Yeah.
still keeping his bag. I was keeping his like, oh, he's going to resume, and like people thought I was going crazy.
I understand. Yeah.
And work, they had to give me like time off work. I had to leave the house itself just to like,
Because
get
you
into
took
this
care of him for years.
For
Like you
years, he
experienced
was-
several important aspects of his life, like milestones. So
We
I
did
can
a lot of
understand.
things together. He cooked. He loved cooking. So he would hold the lamp even when there's no
That's
lamp. Yeah, he would
nice.
hold the lamp. That's one experience I'll never forget. Like whenever he's cooking, I'm like, oh, okay. I don't want him to get too close because of the saliva and everything.
Yes.
This is people's food.
Yes.
But he would say, no, you gotta get his handkerchief. He would continue to wipe that. You can see I'm wiping it already. Like then he would go
Wow.
and get them just to make sure that he stands with me in the
He's
kitchen.
present,
He's
yes.
present. So it was a big struggle for myself. It was another struggle for my other brother, because he's not someone that communicates. He does not know how to communicate very well. He does not express himself that much. So he isolated himself too. We were just in the house. Nobody's saying anything to anybody. We're just trying to move on. Then with time, we just realized.
You just have to understand that.
Yes.
Yes.
So what we just do is we just remember him. We remember the beautiful times we spent together.
Yes.
We laugh about it. We talk about it. We talk about, oh, we miss his dance, and we just try to keep those memories.
Yes, I
with
think
us.
that's one of the beautiful things I always tell people about when you lose a loved one. Like the best thing you can do is to keep the person's memory alive,
Yes.
and just talk about like the good things, not even the bad things, the good
Yes.
things, the experiences you had with the person, just to keep that memory alive.
that
And
talking is
yes,
healing.
yes, it is healing actually. The ability to be able to talk
Yes.
to,
So
yes, it is healing.
along the line, you get comfortable.
Yes.
You saying it. Before now, I thought I was going to cry.
Yeah, I
Once you just
yes.
I'm already telling you, but I
Yes.
think it's part of the healing.
Yes, it
too.
is part of the
And
healing.
I'm
Yes.
I'm so glad that you brought me here to talk about him.
I'm actually happy
I'm so
to,
glad.
like, I'm trying not to even get emotional, but I'm happy that I brought you actually to talk about him, because I felt like, if you remember, I felt like, I know I spoke to you during that
Yeah,
time, and I felt like part of the things that would really help is to talk about his story, and also to tell the world about how amazing Daniel was, and even families or people that have maybe a child or a family member with cerebral palsy, to understand that, first of all, they are not alone. That's one. Number two, if they've not maybe registered the child in a school, they can register the child in school, not isolate the child, and not to feel bad, or feel like, oh, the world or something has rejected them, but to create hope and a sense of awareness that these people are humans, there is still life, but to also throw more light on our healthcare system in Nigeria, especially, that the truth is we can do so much more. We can be more empathetic. We can express some form of emotions, especially Nigeria healthcare workers. I don't even want to start pinpointing if it's nurses or doctors. No,
there's this
every
yes that he lacks. There's this compassion
yes
that he lacks.
yes,
and I don't know. They feel like, oh, you should be privileged that we are even.
they are even here to help you,
yes,
which is a terrible thing, because it will be the other way around. Medical practitioners are called to serve, whether we like it or not. That's the reason why we decide to go to school. The idea is to serve people.
I think that the condition of the country may have,
affected them. Yeah.
But one thing they should always remember is that they are there first for the people.
Yes.
If you would not be able to cater for people, there are other sectors in the medical line that you can. Maybe you go to HMO, you become a therapist or anything.
Yes.
You try to find another path that you know that, oh, you'll be efficient in, rather than you just throw people away. You just, the way they even announce something, there's no compassion. There's no
compassion. There's no discretion.
Exactly, like, oh, she's like, what? There's nothing we can do.
Like, you get, like, nothing. How don't you have emotion? You have family members.
Yes, which was the other hospital that we went to. It was very different. I did not even know that he had passed.
Wow.
They just said, oh, he's responding, and they just wait outside. So I think they were
trying to really monitor how you respond. Yes.
So until I became relaxed, so I stood at the yard there. After I became calm, the doctor called me. He was not even the only one. There were like 2 other people with him, and he was like, okay, can you walk us through? So they made me even do the talking to make me comfortable. So they said, oh, okay. Then they went with, oh, he really did fight, but with the way they saw the scan, his brain scan and every other thing, that there was no way to have helped him and him
actually survived.
So even when they announced that, it broke my heart. But the way they brought the news to me, there was deep down my mind, I felt, okay, I feel he has to rest at some point. The struggle was becoming too much.
Yes.
He was bumping his head on the road. There were times that we would just be inside the house and we hear, oh, your brother just had a seizure, and I'm running down to the road, I'm running down the street, and we had to like carry him. So it brought a lot of attention to us. Like, even in church, it happened. We would just be having a wonderful service, and they're like, oh, please just come to the back. So the seizures were much like, it's even the head. Once it happened, the head falls on anything, pavements, and all of that. So when they actually explain the things, worst things that he may get to experience, but as shocking the news were, okay, he's resting.
It brought some sort of soothing to you, so that he's
I think
resting.
that's what they can actually do. That say, oh, the person has gone, and he's got that thing. Next.
Like, yes, I guess. Yes. I agree with you actually. So my last question to you is so if you could speak directly to healthcare workers or even regulators, policymakers today, what would you want them to hear from your story? What's that thing you want to tell them?
So what I like to say is this: we know you guys are doing a lot. the country do not appreciate you as you want to be appreciated. But we're saying thank you.
Yeah.
The world is a better place because you guys can, give us pay relief, this and this. So we really appreciate. But there's still more to be done.
Yes,
There's
I
still
agree.
a whole lot of gap where we compare what we do right here and outside the country. As in terms of facilities, there are equipments that we need to step into. There are simple things that need to be done. Like it needs to be done, and there's no point in procrastinating. What is what doing well. So we need you guys to love us, talk to us with compassion, give us the right prescription. There's no need in turning us around like, oh, you know that this thing is this, and you're trying to go and do another test to make it look like, oh, we've tried all we could. You can do everything.
Yeah.
So we just need you guys to like treat us well. We are your families too. I could be your sister or anybody.
Exactly.
So we need them to really, have more compassion
Yeah.
for patients, have more compassion for people, and for the government to policymakers. They need to like, we know that some hospitals like they overuse, they are understaffed, that you have like just one doctor and
Attending
one,
to-
yeah, one doctor is working 12-hour shifts money. So we know how exhausted. So
Yes.
they need to look at those policies, and they need to check hospitals too that
Yes.
they are not overusing. Because even to speak for the doctors too, you see times that they say, oh, they pass out after 12 hours short
Yes.
surgery. So we need them to be treated as human beings too.
Also,
they need to
yeah.
check hospitals that, oh, are you guys following our guidelines? Are you
Yes.
following our policies? Are you not overusing your doctors or your nurses and all of those things? And whatsoever initiative that the government can bring in, if it's training outside the country, all of those things, they need to be a collaboration.
Yeah, I agree with you
There needs to be
actually.
a collaboration to bring the country to a better place.
Yes, I agree with you. Thank you so much, Omotola,
Thank you
for
for having
coming
me.
today to share your story. And I know that Daniel's memory will continue to live on in our hearts and would always create more awareness. I really appreciate your
Thank you.
time.
Sorry, I would like to say this to people that have like special
Yes.
children with special needs. One of the things that keep them is the love
Yes.
that you give to them. Once they see that they are loved, it gives them this confidence that they are loved everywhere. Even
Yeah.
when they get outside their space, they still have that mentality that, oh, I'm loved here.
Yeah.
So they need to do not isolate your children.
I
Let
agree with you.
them have fun, playground and everything. Then it will help you too in your journey with them.
Yes. Thank you so much.
Thank
Thank you so
you.
much for watching this episode. We'll see you again in the next episode.
See you guys.
Bye.
Bye.